you direct a weight loss clinic here in New York. What does the data show about what kind of diet would be most optimal for keeping weight off or for reducing weight? We just started an Instagram account and saw your Instagram and we saw a picture that you had on there where you're wearing a t-shirt that says carbs. So
it's one of my favorite shirts.
You are the director of a weight loss clinic here. Tell us, what's the deal with carbs? Everybody's afraid of potatoes and bananas.
Right.
So what is your recommendation for that?
So first of all, when it comes to weight loss, I think a lot of people, because there's so much frustration and sort of almost desperation around weight loss, I think, people are always looking for something that's going to help them lose weight quickly and, get to their goal as quickly as possible. And the truth is that there's an endless number of different diets that you could put a person on and they would lose weight. And to the extent that you limit calories, you're going to lose some weight. So as a physician and someone who cares about not just short-term, but also medium-term and long-term health, I'm really looking at strategies that help with weight loss, but also promote health. So for me, the strategies that are commonly recommended or that people hear a lot about, the low-carb strategies, for example, I don't really recommend because people necessarily miss out on a lot of really important nutrients when they eat that way, and the studies show that people have higher rates of cardiovascular disease and cancer and even earlier death when they eat that way. So
when they eat the low carb diet, which is basically high in animal protein, usually animal protein and fat,
right,
which would be so like Atkins, like paleo,
to some degree paleo, but primarily an Atkins style diet, and there's a lot of different variations on those diets. So for me, the big picture is short, medium, and long-term health, and achieving weight loss sustainably and healthfully at the same time. So for me, again, that equates to a plant-based diet, and luckily there's a lot of evidence that plant-based diets work great for weight loss. We have studies showing, first of all, that again, when you compare different types of eaters, people that eat plant-based diets, like vegans, tend to have not only they have the healthiest body weights. In fact, in the Adventist group, they were the only group that were not overweight. And this has been reproduced in many other studies as well. So epidemiologically, we know that people following plant-based diets tend to have healthier body weights. We also know that prospectively, looking forward in time, the foods that are most associated with weight gain are actually animal products and meat and low fiber diets. So that's two strikes against some of the other diets that are out there. And then finally, studies also show that people who follow mostly a whole food plant-based diet, meaning eating plant foods in their most unprocessed or less processed forms, tend to be able to eat as much as they want when they're hungry without measuring portions or counting calories, and they still can lose weight if they want to. So to me, when I think about, I'm no stranger to counseling people to count calories or measure portions. That's a way that I used to practice. And I can tell you it's not fun to do it, and it's not fun to recommend it, and people don't like doing it. And it may work in the short term, but it's not really a sustainable way to live your life, and it's not enjoyable. It's not a life of abundance, where my experience personally and my experience with my patients in following a plant-based diet is that it is a life of abundance. And you actually end up experiencing foods that you may not have tried before and eating when you're hungry and not feeling deprived and feeling more energetic and having all these other side health benefits at the same time. So
that's wonderful. And you mentioned right now that talking about animal foods, that a lot of data links it to people who eat the most animal foods have the highest amount of body mass index or weight.
Right.
So that's very interesting, and I'm sure a lot of people don't know that. Right. And you've written about common misconceptions that your patients express to you quite frequently. What are some of those common misconceptions that you see in patients that you feel are most damaging in general and to their health, that they just have no idea about this thing or another thing?
Yeah, I mean, I think we kind of hit on it earlier when we started to talk about protein and carbs, and I think those two top the list, and they're related, of course. So, this exaggerated concern about protein that we have in our society, I think is very damaging to people, because people seek out protein as if they we're on the border of deficiency. And in my entire years of practice in medical school and residency, I've literally never seen a person who is protein deficient. But I can tell you that all day long, Monday through Friday, every day, I see people who are deficient in fiber. That is the nutrient that we should really be concerned about, and they're opposite, right? Because animal products don't have fiber.
None of them.
None of them.
None of them do.
So again, by fixating on protein, we end up, it's this cost. You pay a price for that. You end up losing out on nutrients that we actually really need to promote health. So, when you look at how much protein people are actually eating, the average person is eating 1.5 times the amount of protein that they need, and often more. So I think if we all ate the recommended amount and stopped there, we'd all be a lot healthier. And luckily, if you eat a plant-based diet, you end up getting, magically, the recommended amount through just following a plant-based diet. There's enough protein in plant foods that you get the right amount. I think carbs is the other big misconception that's out there, and we touched on that earlier, that carbs will give you diabetes. Carbs will make you gain weight. Carbs will are bad for you, just bad. Mm-hmm. And my experience, again, has been completely the opposite. And of course, if you're eating carbs in a very processed form, just like any processed food, it's not going to benefit you. But if you're eating a plant-based diet, which is naturally high in carbs, you'll do great. You'll probably lose weight if you want to. That's the diet that's been shown to prevent diabetes. Actually, whole grains are the most powerful food in terms of preventing diabetes. So it's carbs that prevent diabetes, ironically, even though we always think that people who have diabetes can't eat carbs or have to count their carbs.
And people think, well, if I'm going to be on a plant-based vegan diet, then what is it that I have to eat to get my protein? Like, do I have to eat almonds every day? Right. Or like, how do you just completely, people say, well, where am I going to get my protein? So what is your response to that?
Yeah, my response is that every plant food, every food has some protein. And if you look at broccoli, it has more protein per calorie than beef. So people are often surprised to hear that. And the truth is, broccoli has a lot fewer calories than beef, and that's probably one of its benefits. It has a lot of fiber and fills you up without as many calories. So I always tell people, if you're getting enough calories, you're getting enough protein. Protein is just extremely tied to your calorie intake. So you'll know if you're getting enough calories because you're hungry or you're not hungry.
Basically, if you feel satisfied and you were eating a plant-based vegan diet, you're getting your protein.
Yeah. There's no need to specifically target protein sources in the diet. Just eat a diverse group of foods, make them as least processed as possible, and eat when you're hungry and stop when you're full. It's hard to, it's so simple that it's almost hard to believe, but it works.